while patients waited 18 hours in an emergency room, some dying in the waiting room lobby. The CEO of the hospital got a raise. $1,825,000 a year. This is not a story about one bad actor. This is a story about a system designed to protect the people at the top, no matter how many people die waiting. Cape Fear Valley Health System, based in Fayetteville, North Carolina. In 2011, the CEO made roughly $700,000 a year. By 2019, 8 years later, $1,825,000 a year. That's a raise of 158%. While that was happening, the emergency room was collapsing. Patients at Cape Fear Valley Medical Center reported waiting 18 hours to be seen. 18 hours. In one case, a patient waited 6 hours in that lobby. Then they flatlined. Nurses tried to bring them back. They couldn't. That incident triggered a federal investigation. Investigators found conditions so dangerous that the federal government almost canceled the hospital's Medicare contract, the funding that keeps the whole place running. The fix? They hired hundreds of travel nurses at premium rates to fill the gaps. 0 executives were fired. 0 executives took a pay cut. Instead, the board approved raises. Now, here's where it gets really obscene. During the COVID-19 pandemic, hospitals across North Carolina took $1.5 billion in federal relief money. $1.5 billion of your tax dollars. That money was supposed to keep hospitals staffed, keep beds open, keep patients alive. And what did Cape Fear Valley and other major hospital systems do with it? They posted record profits. They gave their executives record bonuses. And then, when the money ran out, they laid off hundreds of nurses. A 20% pay cut for a CEO making $1.8 million a year. That frees up $365,000 a year. That's enough to hire roughly 6 nurses. 6 nurses means 6 more beds open. 6 more patients seen. North Carolina State Treasurer Dale Folwell looked at all of this. The pay raises, the empty beds, the patients dying in waiting rooms. And he had a name for it. He called hospital systems across the state cartels disguising themselves as nonprofits. Think about that word. A cartel is what you call the people who extract maximum money from the people trapped in their system. That's exactly what these hospital executives are doing.
$1,825,000 a year for a nonprofit hospital. And they couldn't afford to keep enough nurses on staff. They couldn't afford to keep beds open. They couldn't afford to see patients in less than 18 hours. But they could afford to give their CEO a 158% raise. And they could afford to take $1.5 billion in COVID relief, your money, taxpayer money, and use it to post record profits and give their executives record bonuses. While nurses burned out, quit, and left the profession because the job became impossible. Being asked to do the work of 5 nurses for the same pay because the hospital would rather cut corners and let people die than touch $1 single of executive compensation. And here's what I need you to understand. This is not a Fayetteville problem. This is not a North Carolina problem. The state treasurer's report looked at hospital systems across the entire state, and the pattern was the same everywhere. Executive compensation going up, staffing going down, patients paying the price, and nobody at the executive level facing any accountability. Nurses lose their licenses. Administrators get gold-plated pensions. That's the American healthcare system. That's what nonprofit means in this country. It means we get to write off our profits, keep our executives rich, and you get to wait 18 hours and maybe die in the lobby.
Last we checked, those executives are still running those hospitals, still making the same money. Folwell did his report. He put the numbers out there. He called them cartels to their faces. Nothing changed, unless somebody gets angry. Like and subscribe to find out who makes the Otter angry next.
The Angry Otter is not a licensed healthcare administrator, hospital consultant, or expert in nonprofit tax law. If you are a hospital executive currently earning $1.8 million a year while your emergency room has an 18-hour wait time, and you are watching this video instead of, I don't know, hiring more nurses, you should get back to work. Side effects of watching this video may include a sudden urge to look up your local hospital's nonprofit filings, calculating executive compensation ratios at inconvenient moments, and a deeply unsettling awareness that nonprofit is a tax classification, not a moral promise.